So my ISM presentation is over innovative treatments for schizophrenia. Some information in this presentation comes from outside sources. My name is Neha Grover, and my mentor was Dr. Altaf Loya. He is an adult and geriatric psychiatrist. He works at Houston Behavioral Health Care, and this is ISM of fall of 2015, and my teacher is Miss Christy Click. So Dr. Loya attended medical school at Dow College in Pakistan and completed his residency at the Medical College of Virginia. He is board certified in adult and geriatric psychiatry, and he specializes in dementia care, senior care, and hospital consultation. So that's his business card, and there's a picture of me and him. And ISM is a collegiate level course that allows students to choose a mentor in a career of their choice and get a semester to basically follow them for 2 hours a week and see what they do. And throughout the course of this class, you must complete an online portfolio that showcases all the assignments you've completed in the final product. So here's my online portfolio that we created, and basically has everything that I've done throughout this course. So there's a picture of me and my mentor, and then we had to write a paper about what project we wanted to choose. So I have a whole paper, and then each week we had to complete a journal entry, basically talking about what we did that week with our mentor and sharing our experiences. So I have one for every week of this semester so far. And we had to complete activity logs showcasing how we spent our time throughout the year. We had to get at least 3 activity hours a week and then 2 hours with our mentor. So that's just what our documentation looks like. And then there are different class assignments, like a goal setting form. Here's a poster project that we created that talked about like what project I chose to do. So that was in the beginning part of the class, deciding what I wanted to focus on. And we did an interview assignment. There are different interviews, there's research, and there was a survey. And then we had a midterm presentation, which was about half of what I'm presenting now, and we just had to get that done so it shows like the progress throughout the year. And then here's my final presentation and project. So I have my invitation that I made, and then I have an outline, a PowerPoint presentation, which is what we're going through, and we had to get artifacts throughout the year. We had to get 10 that our mentor gave us or stuff that we got out of the experience. So I have things like notes I took, our rubric that she gave us, his business card, different responsibilities he talked about, symptoms and signs of a disease that I chose. I picked the one that I'm doing my presentation over. Just basic information about everything for my final presentation and how it was going to help me. So there's that, and now we can get back to the presentation. So schizophrenia is a severe brain disorder that causes people to hear voices others do not hear and to believe that people are out to get them and trying to harm them. And about 1% of Americans are diagnosed with schizophrenia. And that's kind of a picture of what they feel like. They feel like someone's always trying to get them, or people are in their head, voices are in their head, and they just can't really control it. Symptoms of schizophrenia include hallucinations, delusions, thought disorders, and movement disorders such as shaking. I actually got to experience one interaction with a schizophrenic patient, and the whole time, like he had been stable for a couple of years, and he had been coming to Dr. Loya for a long time, but even though he was stable, the whole time we were talking to him, he was like shaking and jittering the whole time. Schizophrenia can be genetic or caused by an imbalance of chemicals in the brain. It's usually triggered by changes, major events, or drugs. So say if they were abused, maybe a car accident could cause it, rape, drugs, alcohol. There are different things that can cause it. So they already have it like in their genetic makeup, and then different things can set it off. And there's no cure, but there are treatments to help deal with this condition. So that's what a healthy brain looks like, where the X figure isn't as defined, and then in a schizophrenic brain, you can tell that it's much more enlarged. And patients who are unable to live at home prefer to live in a psychiatric community than an inpatient hospital, because in a hospital they get lonely, and with this they can make friendships and have like social events and interactions. They would rather live by themselves and not be as dependent and just have support when needed, because they feel helpless if they can't do anything on their own. And it allows their knew about schizophrenia and their personal experiences. And some of my hypotheses were people over the age of 35 are more likely to know someone who suffers from schizophrenia than people between the ages of 13 and 18. And 50% of people with schizophrenia were diagnosed at the age of 21 or older. But the problem with my survey is a lot of the people that I got results from were teenagers, so they didn't know much. I got about 30 responses, but mainly were teenagers, so a little bit of get more adult input. But most of the people I interviewed did not know anyone with schizophrenia, and the people that did know someone, that patient had been hospitalized many times, averaging between 7 and 10. So it got to the point where they couldn't handle it on their own, and they had to go to a hospital or psychiatrist to see them. So here's one of the graphs of my results, and at what age were they diagnosed with schizophrenia. It was all pretty even, but as you can see, 28 people skipped it, and only 3 people answered. So it would be more accurate to get people that knew more. So for treatment of schizophrenia, there are 2 different phases. One is called the acute phase, and that's treating psychotic symptoms currently going on. And the other is called the maintenance phase, which is preventing future psychotic episodes. So once they're stable, it's just how are we going to prevent it in the future. But an issue with treating schizophrenic patients is a lot of times once they get past the acute phase, they feel like they're okay, and then they just don't want to take their medicine anymore. So then they're back to square one, because it's like they have another psychotic episode because they want to. So I chose this topic because I'm interested in the condition, and we want to research new treatments that will help patients in the future. And the treatments I chose to research are Rotulti, Simodazine, intracellular therapy, and electric shock therapy. Rotulti is an FDA-approved add-on medicine for major depressive disorder in adults, so it can't be taken alone. You need to have it along with another medication for schizophrenia. And it was tested in 2 separate 6-week placebo-controlled clinical trials on adults only. It's not made for kids. So the success of it, on the positive and negative syndrome scale, which is what schizophrenic symptoms are tested with, it proved to be superior to the placebo. And some side effects the most common were weight gain and restlessness. And then others that were less common, but they could happen, are stroke for elderly, high blood sugar, and low white blood cell count. And some also had difficulty swallowing. So that was kind of my final product. I just made it in the shape of a pill. And another drug I chose was famotidine, and Pepsin is the brand name for this. It's normally used to treat heartburn, but they tried increasing the dosage to see if it would work for schizophrenic patients, and when they increased it by 5 times, they saw some results. So it was conducted by separating 30 people into 2 different groups and giving 1 placebo and 1 famotidine. And symptoms started to ease within a week and then significantly after 4 weeks. So it was pretty successful. And it works by blocking the histamine H2 receptor, which is used for signaling in the brain. There's different receptors in your brain that send signals to the rest of your body, and that one happened to target the H2 receptor. And doctors said it needs more testing because making a dosage that high could potentially be a risk in the future. And then my last drug I picked was ITI-007, and it targets multiple brain systems, which allows physicians to adjust the drug's action in the brain by changing the dosage. So increasing the dosage allows one to target the dopamine and serotonin receptors, and dopamine and serotonin receptors there are many drugs for this, like ADHD or ADD medicine, ADHD. It gives people like happiness, so like dopamine. That's why a lot of dope, the drug, it gives them happiness. And it helped to treat agitation, aggression, and sleep disturbances. It was tested on 335 adults in the acute stage of treatment in 3 phases. So phase 1 and 2 have been released, and 3 isn't out yet. So I'm sure once it is, more doctors will try starting it. And it reduced negative symptoms associated with schizophrenia. It didn't cause any more side effects than placebo, so that was good. And some side effects that it did cause included drowsiness, sedation, and fatigue. And then my last treatment I chose to research was electric shock therapy because it seemed really interesting to me. And this is more of a last option treatment, so if nothing else works, all else fails, doctors usually suggest this. And it's used to be in combination with other medicines, sort of like how Rexulti was. It benefits those who do not respond to medicine or anything else. And modern techniques have become much safer. So they're usually given in 6 to 12 treatments, given 3 times a week, so Monday, Wednesday, Friday. And they'll give it either for 2 weeks or 4, depending on how severe it is. Immediate side effects included headaches, muscle aches, soreness, and nausea. And it causes partial memory loss, but like right after the treatment, but usually the memory comes back within a couple weeks. So along with this, I thought this was really interesting, so I made a video.
The bulk of our research is really trying to understand how inducing a generalized seizure improves psychiatric disease, to kind of use this understanding to kind of have more focal and kind of more improved, less invasive treatments.
What shows up in this brain?
What we know about from depression, specifically late life depression, is associated with hippocampal atrophy. The hippocampus is part of the brain that's going to be what we call plastic. It's amenable to change with experiences or disease processes. So the stress or depression in and of itself is enough to make this part of the brain shrink, much like it does in Alzheimer's disease. Unlike Alzheimer's disease, though, we have a treatment that actually restores the volume of this part of the brain within a month. So we're actually looking at a treatment that really grows the brain, but it grows into such a degree that it's consistent with normalization. The brain is different, especially within the hippocampus, smaller volumes, decreased connectivity prior to ECT. And then after ECT, it really looks like a normal brain, and that's really consistent with the return of level of functioning. And it from a clinical perspective, it's always a source of satisfaction and amazement to see somebody go from acute suicidality, anorexia, psychosis, to the point where they're going back to work in a month. So it's a real, in our opinion, a very exciting finding, and it really destigmatizes, I would think, a lot of ECT fallacies, if you will. The design was very simple. We would image folks before they start the ECT series. When they finished, we invite them back and we give them another brain imaging assessment and a clinical assessment. It's really anticlimactic, and we like it to be anticlimactic. The patient goes to sleep, we get muscle blockers. The only evidence we have of seizure activity occurring is we put a blood pressure cuff on the right ankle, and that blocks the blood flow, and specifically the paralytic. So the only thing we see moving is the right foot. That's it. Otherwise, the patient's just lying there. So we are in a really unique and privileged position in order to kind of capitalize on our inpatient psychiatry facility and get folks into the scanner that doesn't interfere with their treatment in a way that's really conducive to allowing them to be receptive to research and then following them longitudinally. First and foremost, though, it's the clinical response. And as much as we want to make this a clean, rigid research protocol, the patient needs trump all that.
So that video kind of displayed what electric shock therapy actually looks like, because many people, when they think that, think scary movies, patients getting shocked, and really it's just a simple little probe that goes on their head and it lasts 40 seconds and then it's over, and patients actually have gotten better with this. So now it's become much safer compared to years in the past, and it's actually a good last option treatment. I thought that was really interesting. And so this course gave me insight on what the medical field is actually like, and it let me explore the world of psychiatry. My favorite part was getting to interact with patients. Like I said, I got to interact with one schizophrenic patient, but I saw many different types of patients, different people, and it was really interesting getting to see all these different people and how Dr. Loya reacts with them and how he interacts with them. And most psychotic disorders are actually treated with similar medicines. So a medicine for bipolar disorder could also be used for schizophrenia and depression, and a lot of them work interchangeably because they connect to different parts of the brain. So with these treatments that I researched, it was really interesting to see new treatments that they're creating and how these different things are working, but most doctors don't really feel comfortable giving patients new stuff until they know how it works. They'd rather stick to routine, stuff that they know has worked in the past, and they want to stay on the same track so they make sure their patients are okay. It's scary to try new things, and they don't want their patients to get the bad side effects. So once it's been tested more, I think doctors will start using these drugs more. And I would like to thank my mentor, Dr. Loya, for making this mentorship possible, my teacher, Ms. Click, for helping me through the whole process, and my parents for providing me with the mentor and providing me with all of the resources necessary to complete this project. So do y'all have any questions?
Are you going to pursue this career?
I want to pursue medicine for sure. I don't know if psychiatry is the right field for me. I think it's really interesting, but I don't know if I could sit there every day and do it. It's really admirable how he does, and it's kind of you get to meet a ton of different people, so that's really cool, but he sticks to the same questions, and he asks them, how are you feeling, how are you eating, how are you sleeping, what's your mood like? And I feel like the appointments go by really fast and it's not really on a personal level. He's definitely doing so much to help them, and his patients love them, or love him. But at the same time, I feel like if you're gonna talk to people and help them through their problems every day, it's not really like in depth enough for.
To get an insight on what they're feeling
Yeah,
and everything.
it's more on the medical aspect rather than their actual feelings. But I do like the medical field, and it was really cool to see how like a private practice runs and how he runs his business every day.
Well, that's amazing.
Thank you.
That's amazing. By the way, I know personally of two family
Really?
members schizophrenic, bipolar schizophrenic. So
Yeah,
Very
it's
interesting
interesting to
because-
see, and it's great that they're coming up with new treatments that are going to help these patients in the future because, like I said, there's no treatment, there's no cure, but there are treatments to help them live with this and deal with this and to make their family and friends feel comfortable and for them to become more stable and okay to be around everyone is important.
Yes. And when they don't take their medicine, you are right. They do act a whole different
Yes,
way.
and that's what Dr. Loya said when I met with one of the patients. He was talking to him about about past experiences that they had, just because Dr. Loya knew that this is what my project is over, so he wanted to give me some experience with it and some insight on it. And he asked him about the patient had previously had issues with the cops, and he thought the cops were out to get him, and they were talking to him and saying all this stuff to him. And when Dr. Loya asked him about it, he completely disregarded it, didn't remember it, didn't want to think about it, because he said like that part of his life is over. He doesn't want to have to think about it and relive those memories anymore. So those,
that is interesting.
I guess they can just block that out to be happy, and that's good that they can not remember it and
Oh, yeah.
be happy. So well, thank y'all for coming to watch.
Thank you.
Here's my works cited.
It was a very interesting.
Yeah, you did a really good